So I got this message earlier from a viewer. So it reads, "Thank for the omeprazole information. My husband had been on it for 7 months before I saw your TikTok and sent him back to the GP. The GP agreed to send him for an endoscopy. Turned out he had stomach cancer. If you hadn't done the TikTok and I hadn't sent him back, the story would have been very different." I'm Dr. A GP based in the UK. Now I've been getting a lot of messages and questions about omeprazole and whether it can or can't cause cancer. It's important to note that there are some conditions, such as Barrett's esophagus, for which you need to be on a PPI like omeprazole long term, or when you're on certain medication that require stomach protection long term. Omeprazole cannot directly cause cancer, however, it can mask one of the common symptoms of stomach cancer, which is heartburn or acid reflux. And I keep saying this point in lots of my videos, that if you're on omeprazole long term and was started on it for heartburn or reflux and have never been reviewed while you've been on it, please make sure you go and get a review and just mention that you can't function without it, and every time you try and stop, your symptoms get worse if that's the case for you. Also, it's very important just to make you aware that if you've got heartburn or reflux, the chances of it being stomach cancer are very, very low. There are far more common reasons for you having those symptoms. So this video is really for those people who have been started on omeprazole or lansoprazole, within the last 2 or 3 months, are still having heartburn or acid reflux symptoms and are not getting better. Please make sure you go to your GP and get investigated, because you'll need blood tests, examinations, and maybe an endoscopy. But that is something that you and your doctor need to talk about. Getting back to the message at the beginning of the video, I just find it amazing that these videos are reaching so many people and making a very useful impact on their lives.